Welcome to the deep dive. Today we're strapping in, you could say, for a high-pressure exploration into hyperbaric oxygenation, HBO.
Extra, yeah.
We're looking specifically at how it's used for, well, musculoskeletal injuries and related orthopedic problems. We got a pretty detailed review here.
Yeah, comprehensive.
And honestly, there are some really fascinating possibilities to unpack.
Indeed. So HBO, at its core, it's a medical treatment. Someone breathes pure 100% oxygen.
Inside a special chamber.
Exactly. Inside a chamber where the pressure is significantly higher than normal air pressure. Think like going deep underwater, pressure-wise.
Okay, but with oxygen.
Right. Oxygen pressure, not water pressure.
Okay, let's dive in then. Listener, our mission today is basically to cut through the science, get to the key insights. How does breathing this pressurized oxygen work as a support therapy, especially when injuries cause that oxygen starvation in tissues? Hypoxia, right?
Hypoxia, yeah.
Yeah.
That's the key target.
And believe me, we're going to uncover some genuinely surprising potential uses here.
Definitely. The material we're looking at today covers a remarkable range of conditions where they've looked at HBO.
Like what sort of things?
We're talking severe trauma, like crush injuries, stubborn fractures that just won't heal, even damage to peripheral nerves.
Wow. Okay.
Yeah, it really gives you a sense of the breadth of where this therapy might fit in.
All right, let's start with something that sounds incredibly serious. Crush injuries. This isn't just a little bump or bruise, is it?
Not at all, no.
Yeah.
Crush injuries mean really significant damage. Multiple tissues, muscle, bone, nerves, skin.
Everything in the area.
Pretty much everything can be compromised. Severity ranges from, tissue that's barely viable to damage that's, unfortunately irreversible.
Okay.
But there's often this critical gray zone. That's where therapy aims to boost the chances of survival for that tissue.
So what's happening physiologically, in the body, I mean? What makes this high-pressure oxygen potentially so useful here?
Well, the initial trauma kicks off this chain reaction. Damaged tissue swells up, that's edema.
Right, swelling.
And this swelling then presses on nearby blood vessels, restricts the blood flow.
Leading to ischemia.
Ischemia, exactly. A lack of blood getting to the tissues. And that, of course, causes hypoxia. The cells aren't getting enough oxygen.
Okay.
But here's the kicker. The edema itself makes the oxygen delivery problem even worse.
How so?
Because it increases the distance oxygen has to travel, diffuse from the tiny blood vessels, the capillaries, to the actual cells.
Ah, I see. So it's a vicious cycle.
It's a classic vicious cycle, yeah.
Yeah.
Self-perpetuating.
And HBO can potentially break that cycle.
That's the idea. Exactly. HBO hits the hypoxia directly by dramatically increasing the oxygen levels in the tissues.
How much are we talking?
Well, when you breathe 100% oxygen under, say, 2 to 3 times normal pressure, the amount of oxygen dissolved just in the blood plasma can shoot up, maybe tenfold.
Tenfold. Wow.
Yeah. This creates a much bigger pressure gradient, like a stronger push.
So the oxygen can get through the swelling.
Right. It forces its way through that edema fluid to reach the oxygen-starved cells, even if the blood flow itself is still pretty low.
And you mentioned it helps with the swelling, too.
It can, yeah.
Yeah.
It also seems to cause some vasoconstriction, a narrowing of blood vessels, which can help reduce that edema buildup.
That sounds, incredibly helpful. Is there good evidence that this actually works in people?
There is. There was a key study back in the mid-90s, a controlled study.
Yeah.
Patients with severe limb crush injuries got either HBO or a placebo. The group getting HBO twice a day for 6 days.
Yeah.
They showed significantly better healing and, importantly, needed less follow-up surgery compared to the control group.
In any particular group, it helped more?
It seemed particularly helpful for patients over 40 who had the most severe soft tissue damage grade 3 injuries.
And they measured oxygen levels?
They did. They measured what's called PCO2, basically oxygen levels in the skin, and they found a significant sustained increase in those levels in the patients who healed well with HBO.
That's pretty compelling evidence. What about other research? Any consensus?
Well, a big review looking at lots of studies found that, the majority reported a benefit from HBO for crush injuries.
Any downsides?
Very few reports of harm, especially if it was started early on. And a more recent study, I think from 2014, a cohort study backed this up. It showed HBO seemed to reduce complications and the need for more operations.
So the overall picture is pretty positive then?
Generally, yes. The evidence points towards a benefit.
And it sounds like timing is crucial, getting treatment quickly.
Absolutely critical, yeah. The chances of a good outcome, limb survival, drop off significantly if you delay treatment beyond maybe 5 or 6 hours.
Especially if the limb looks bad.
Right, if it stays pale or bluish and really swollen. And you also have to remember the high oxygen levels in the tissues after one HBO session, they don't last forever.
Oh, right. How long?
Maybe an hour or so in muscle, a bit longer in the skin perhaps, which is why initially they often need frequent treatments, multiple times a day to stabilize things.
Okay, got it. Let's shift gears slightly. Traumatic ischemia, how does that relate?
So traumatic ischemia just means not enough blood supply to tissues because of trauma.
What kind of trauma?
Could be direct compression of blood vessels during the injury, actual damage to the vessels themselves, or it can happen because of compartment syndromes. We'll probably get to those.
Right. And what happens when tissues are starved of blood after an injury? What are the downstream effects?
It's a cascade, really. You see edema again, swelling, but also problems right down at the microcirculation level, the tiniest blood vessels.
Like what?
Reduced flow in capillaries, damage to the vessel lining, even white blood cells kind of plugging up these tiny tubes.
Okay.
And then there's this thing called reperfusion injury.
Reperfusion, when the blood flow comes back.
Exactly. When blood flow returns to tissues that have been starved of oxygen, paradoxically, it can sometimes trigger another wave of damage,
How?
often involving the formation of harmful molecules called free radicals. Plus, the cell's energy stores like ATP and creatine phosphate get depleted.
So, again, it seems like boosting oxygen with HBO could help here, too. What did the studies show?
They do suggest that. Animal studies have been useful. Work on rats using tourniquets to cause ischemia showed HBO significantly reduced edema, and that effect lasted.
Okay.
Other studies showed HBO can boost energy production, the aerobic metabolism, in ischemic muscle. It seems to improve blood flow and capillary density, too.
What about those free radicals? Wasn't there a concern HBO might make that worse?
There was initially,
Yeah.
but interestingly, animal studies actually looked for signs of free radical damage, lipid peroxidation in ischemic muscle treated with HBO, and they didn't find an increase.
That's good to know. What about human studies? Clinical reports?
There are some quite dramatic ones. A report from the late 70s described soldiers with severe gunshot wounds to major arteries.
Yeah.
In some cases, just repairing the artery wasn't enough to save the limb. But adding HBO treatment led to significant improvement, prevented amputation.
Oh.
Another study later on found HBO led to limb salvage, or major improvement in most patients with acute post-traumatic ischemia, even when treatment was started a bit late.
And in complex cases, maybe with other health issues.
Yeah, there's evidence that combining HBO with other things, like nerve blocks or specific surgeries, can be effective, especially in patients who already had some vascular disease. It's helped save limbs that might otherwise have been lost.
So it really seems like it can be a lifesaver or limb saver in these critical scenarios.
It certainly appears that way. There was even a more recent case report where HBO helped doctors figure out which tissue was still viable in a really bad crush injury.
So it helped with diagnosis, too.
Yeah, it helped define the boundary, which ultimately allowed them to avoid amputation. So valuable for treatment and potentially for assessment in these tough cases.
Okay, let's move on to compartment syndromes. You mentioned them earlier. Can you explain for the listener what exactly is going on there?
Sure. Compartment syndrome happens when pressure builds up inside a closed muscle compartment, usually in an arm or leg.
What's a compartment in this context?
It's basically a bundle of muscles, nerves, blood vessels, all wrapped up in this tough membrane called fascia. It doesn't stretch much.
Okay.
So if there's swelling or bleeding inside that compartment, the pressure goes up. And that high pressure can squeeze the blood vessels and nerves.
Cutting off blood flow.
Exactly. Leading to ischemia. And if it's not treated quickly, the tissue can die necrosis.
So how does HBO fit in here? The problem's pressure, right?
The initial problem is pressure, yes. But the consequences are ischemia and edema. And that's what HBO targets.
Okay. It addresses the downstream effects.
Precisely. Its ability to correct ischemia and edema is key. Animal studies have shown HBO can reduce muscle damage in experimental compartment syndromes.
So how might doctors actually use it clinically?
Several potential ways. Maybe in borderline cases where the pressure is high, but not so high that surgery is immediately obvious.
So use HBO to try and avoid surgery.
Potentially, yeah. To try and prevent it from getting worse, maybe avoid the need for a fasciotomy, that's the surgery, to cut the fascia and relieve the pressure.
What about if surgery is definitely needed, but there's a delay?
Then HBO could be used as a sort of bridging treatment to limit further damage while waiting for the OR.
Okay, and after surgery?
Even after a fasciotomy, If there are still issues, like nerve problems or some muscle death, HBO might help improve recovery.
That's interesting, the idea of using it in those early stages, maybe preventing the need for the fasciotomy in some cases.
Yeah, the source material really highlights that early or incipient compartment syndrome, before surgery is absolutely mandatory, is a tricky situation. HBO offers a potential non-surgical way to try and halt its progression.
Any other techniques used with it?
Yes, there's some evidence that combining HBO with something called vacuum-assisted closure, or VAC therapy.
I've heard of that for
Yeah,
wounds.
exactly. Using that combo after a fasciotomy seems to help get the swelling down faster and allows them to close the surgical wound sooner.
Okay, now for something that sounds weird. High pressure water gun injection injuries? What on earth are those?
Yeah, they're quite specific. These are accidental injuries, usually industrial. Workers using high-pressure water jets for cleaning or cutting.
And they accidentally inject themselves.
Unfortunately, yes. The force drives water and potentially contaminants deep into the soft tissues. It causes extensive damage way below the skin surface.
Ouch. Sounds incredibly painful.
Extremely painful. And it can lead to serious issues like empyema, that's a collection of pus because of the contaminants driven in, slow healing, potential long-term disability.
And HBO helps with this.
Surprisingly effectively, according to the reports. Excellent results, often rapid resolution of the empyema, the swelling, the pain.
If I do what?
Two main theories. One is maybe it helps get rid of tiny nitrogen bubbles forced into the tissue, kind of like treating decompression sickness in divers.
Okay.
The other, perhaps more likely, is that by boosting oxygen, it just alleviates the intense ischemic pain that comes with this kind of deep tissue damage.
Fascinating. Okay, let's shift focus again. Peripheral nerve injuries. These can really impact quality of life. How might HBO help heal these delicate structures?
Well, the thinking is that injured nerves often suffer from poor blood supply, low oxygen, and swelling. This creates a sort of negative environment that hinders healing.
Right.
In the lab, HBO has shown it might be able to restore some essential functions within nerve cells deprived of oxygen.
So the hope is better regeneration.
Better regeneration, yeah. And also reducing that edema and hypoxia around the nerve itself. It's also known that after nerve injury, problems with the tiny blood vessels supplying the nerves can persist.
Leading to chronic hypoxia.
Exactly. Chronic low oxygen within the nerve, endoneurial hypoxia, which is thought to contribute to that persistent neuropathic pain some people get. HBO is good at tackling that kind of hypoxia.
What have the actual lab studies shown? Is it clear-cut?
It's been a bit mixed, frankly. Some studies one in rabbits showed improvements in nerve structure and the myelin sheath with high-pressure oxygen.
Okay, that's positive.
But another study, in rats using a specific repair technique called intubulation, found no benefit from HBO in their model. Other rat studies have varied too. Some suggested maybe it helps the initial nerve fiber outgrowth after a crush injury. But others showed limited or even possibly negative effects on functional recovery or axon regeneration in different injury models. It's not entirely consistent.
Any positive signs?
One study did suggest HBO might improve functional recovery after a nerve was completely cut and then surgically repaired. So some hints of potential.
What about in humans? Has it been used clinically?
There are some clinical reports suggesting possible benefits. One from the early 90s reported better outcomes when HBO was added to surgical repair, especially if the injury wasn't fresh.
Okay. Anything more recent?
A study in 2011 suggested HBO might make primary nerve repair easier, even if there's some tension on the nerve ends.
But what's the bottom line from the source material?
The conclusion is basically that while the lab research shows some promise, peripheral nerve injury isn't currently a standard recognized indication for HBO. More good clinical studies are really needed to figure out its role definitively.
Right. More research needed there. Okay, let's talk fractures. Broken bones. We all know someone who's had one. What's the link between oxygen and bone healing?
Well, a good blood supply is just fundamental for bone healing, right?
Right.
And lack of sufficient oxygen is often seen as a major limiting factor in that process.
Okay.
And interestingly, the kind of tissue that forms first at the fracture site seems influenced by oxygen levels.
How so?
Higher oxygen, especially with the right mechanical forces, tends to favor bone formation. Low oxygen, on the other hand, can lead more towards cartilage formation.
And cartilage isn't ideal.
Not for bridging a fracture long term. It's less vascular, often seen in fractures that are slow to heal or aren't healing properly.
So logically, could HBO speed up or improve fracture healing? Have people looked at this?
Yes, quite a few studies. Some early work in rats showed HBO treatment seemed to accelerate fracture healing, led to a more callus formation. That's the initial soft bone bridge.
Any specific mechanisms?
Yeah, they found increased mineral accumulation, faster collagen. Production collagen's a key protein in bone.
Sounds promising. Any conflicting findings?
There have been some, yeah. One study using bone grown in a lab dish suggested very high oxygen might actually slow down bone, remodeling the process of breaking down old bone and forming new.
Hmm.
And another animal study hinted that different HBO treasures might have different effects depending on whether the fracture area was also inflamed.
So it's maybe not just more oxygen is always better.
That seems plausible.
Yeah.
It might be more nuanced, but there are definitely other positive findings too.
Like what?
Studies in rabbits showed HBO seemed to trigger the bone repair process earlier. Others showed increased mineralization, making the new bone harder.
Anything about treatment frequency?
One study intriguingly suggested that maybe once daily HBO speeds up repair, while twice daily might actually slow it down. Yeah. Needs more investigation, but interesting.
Yeah. Any other specific scenarios?
A study on rabbits undergoing tibial lengthening, where they gradually stretched the leg bone.
Right.
They found that intermittent HBO treatment during that process significantly increased the bone mineral density and the strength of the newly formed bone.
What about clinical experience in humans?
Some early reports suggested good healing rates in long bone fractures with HBO, especially if started early.
And in more complicated fractures.
Combining HBO with antibiotics, cooling, surgery seemed to reduce complications in severe open fractures where the bone breaks a skin. Also positive reports for ankle fracture dislocations treated early with HBO.
What about fractures that aren't healing, non-unions?
Yes, HBO has been reported as a useful addition and adjunct to surgery for those non-unions or pseudoarthrosis, used before and after the surgery.
And if there's an artery injury, too.
Right. In those really complex cases, fracture plus arterial injury, HBO is considered an important part of the whole multidisciplinary approach. Helps control infection risk, improves healing chances for both bone and soft tissue.
Okay. Now let's consider the really extreme end, traumatic amputations and trying to reimplant severed body parts. That sounds incredibly challenging.
It is hugely challenging. When a limb, or finger, toe, whatever, is reattached surgically, even if they get the blood flowing again, the tissues are still at massive risk. Severe swelling, degenerative changes kick in because of that period with zero oxygen.
And if that's not managed,
the reimplantation can fail. The part might not survive.
So in these supercritical situations, how can HBO potentially help?
Well, its ability to tackle swelling, improve that microcirculation, maybe reverse some early damage, that becomes absolutely vital.
Could it even buy more time?
Potentially, yes. Extend that crucial window where successful reimplantation is still feasible after the injury.
Are there actual cases where it's made a difference?
Yes, some really remarkable reports over the years. One from way back in the 60s described a foot that was nearly severed, and HBO is credited with helping a good portion of it survive.
Wow.
A later study reported something like a 70% survival rate for severed limbs that were reimplanted and treated with HBO, even after quite a long time without blood flow.
70%? That's impressive.
It is. And another large series, hundreds of patients with severe crush injuries and amputations, found good functional recovery and fewer complications, infections, non-healing when HBO was part of the plan.
That's incredibly encouraging. Is it just for limbs?
No, not just limbs. There are reports of successful reattachment of severed ears, for instance, where post-op HBO is used.
Ears.
And even a few rare but successful cases of penile replantation after traumatic amputation. HBO was used there to help manage infection and speed up healing.
It's just amazing to think about preserving parts that might otherwise be lost forever. Now, the source also mentions HBO in battle casualties, a very different context.
Yeah. Very different, challenging environment, yeah. Historically, the U.S. Navy pioneered HBO for decompression sickness in divers. Right. And the Soviet Army apparently used mobile chambers in Afghanistan. But generally, U.S. military use closer to the front lines has been somewhat limited, even though facilities exist in medical centers.
But the potential uses seem significant in combat.
Oh, absolutely.
Right.
During the war in Croatia in the 90s, they reported benefits using HBO for vascular injuries in war victims.
What kind of battlefield injuries might it help with?
The source lists quite a few where it could be valuable in emergencies. Things like severe crush injuries, air embolism from explosions perhaps, gunshot wounds causing ischemia, hemorrhagic shock burns, spinal cord injuries, head injuries with swelling. even certain chemical or radiation exposures or severe cold injuries.
So a wide range. Any contraindications?
Yes, one critical one mentioned is not using it in the initial treatment of injuries from nuclear fallout. Apparently, it can enhance the effects of radiation in that immediate phase.
Good to know. Okay, let's briefly touch on osteogenesis, new bone formation. We talked about fractures, but any other ways HBO might influence bone growth?
Yeah, as we saw with fractures, studies do point to a positive impact on forming new bone. And one interesting study looked at rats with rickets.
Rickets, the vitamin D deficiency thing?
Right, affects bone mineralization.
Yeah.
They found intermittent HBO treatment led to a marked increase in calcium deposition in the growth plates of these rats' bones.
Interesting. Now, let's tackle a condition causing long-term problems. Osteonecrosis, also called a vascular or aseptic necrosis. What is this exactly?
Osteonecrosis basically means bone death. Infarction of the bone due to lack of blood supply.
What causes the lack of blood supply?
A whole range of things, unfortunately. High pressure exposure, like diving.
Yeah.
Fat embolism, high altitude. Certain medical conditions, steroid use is a big one.
Trauma too.
Trauma, yes.
Yeah.
And sometimes we just don't know the cause that's idiopathic osteonecrosis. Certain bones seem more vulnerable.
Which ones?
Those with a lot of fatty marrow and maybe not the richest blood supply to begin with. The femoral head, the ball part of the hip joint, is a classic example.
And what happens if you get osteonecrosis? What are the consequences?
It can cause significant pain, often debilitating, loss of joint function, especially if it's near a joint like the hip or shoulder.
And in the hip?
In the femoral head, there's a real risk of the bone weakening, fracturing, and eventually collapsing. That often means needing major surgery, like a hip replacement.
What are the usual treatments and why might they not be enough?
Well, conservative approaches like just taking weight off the joint often don't work well, especially once it's progressed.
And surgery?
Surgery aims to, remove the dead bone, maybe graft in healthy bone, or do procedures to try and improve blood flow. But the results can be variable. It doesn't always stop the disease progression.
Which is where HBO comes in as a potential option.
Exactly. It's generated a lot of interest here as maybe an alternative or something to add to other treatments.
What's the thinking? How is HBO supposed to help dead bone?
Well, the primary goal is to get more oxygen into that struggling bone tissue, trying to revitalize the cells that are still viable on the edges.
Okay.
Plus, it can help reduce swelling within the bone, stimulate the growth of new tiny blood vessels, angiogenesis, and generally improve the microcirculation by lowering the pressure inside the bone.
Can doctors track if it's working?
Yes, absolutely. MRI scans are really good for diagnosing osteonecrosis and also for monitoring treatment. They can look for signs of improved blood flow, bone regeneration. X-rays can show changes too.
Okay. So what does the research actually show? Has HBO been effective for osteonecrosis?
There's quite a bit of research going back decades, actually. Many studies report improvements in patients with osteonecrosis from different causes who got HBO.
Improvements like less pain, better scans.
Both, yeah. Reduced pain and often radiological evidence, signs on the scans of bone healing or stabilization.
Any major reviews?
A meta-analysis suggested HBO's effectiveness for femoral head osteonecrosis is, comparable to other treatments, surgical or non-surgical. And maybe combining HBO with other things works even better.
What about more recent large studies?
The source mentions one of the largest studies reviewed, which found significant improvement in most patients with early-stage femoral head osteonecrosis treated with long-term HBO. Many were able to keep their natural hip joint.
Any cases where it didn't seem to help?
Yes, it's important to note one study specifically looked at osteonecrosis caused by chemotherapy and found no benefit from HBO in that particular group.
So it sounds promising, especially for certain types or stages, but maybe not a universal fix.
Precisely. That's a good summary. The source emphasizes that while the research is encouraging, we still need more high-quality randomized trials.
Right. And cost-effectiveness analyses, too, probably.
Definitely. To really nail down its place in treating this tough condition.
Okay, finally, let's briefly touch on rheumatoid arthritis, RA. That's a systemic inflammatory disease, mainly affecting joints. What's the potential link to HBO?
Right. RA involves chronic inflammation of the joint lining, the synovium. And interestingly, patients with RA often have hypoxia, low oxygen, in those inflamed joints.
Why is that?
Probably a combination of things. The inflamed tissue uses up more oxygen, and local blood flow might be reduced.
So the idea is HBO might help with the inflammation itself.
That's the rationale. Its potential to suppress what's called sterile inflammation not caused by infection. Some animal studies did show HBO could reduce arthritis symptoms in mouse models.
What about clinical studies in people with RA?
Again, the findings have been a bit inconsistent. Some studies reported positive effects, things like increased antioxidant enzymes, lower inflammatory markers, better clinical scores.
Any specific patient groups?
Some research suggested it might be particularly helpful for RA patients with systemic issues, like nerve damage from poor blood flow, ischemic neuropathy, or inflamed arteries, arteritis.
But not all studies were positive.
No, a pilot study back in the 80s didn't find significant benefit and concluded large trials might not be worthwhile.
Anything more recent?
More recent studies have reported, again, some good clinical results, even some hints of immune system modulation, and improvements in pain, swelling, mobility in many patients treated.
So where does that leave RA and HBO?
Well, the overall conclusion from the source material we've looked at is that HBO seems to have shown its clearest utility as an adjunct, an add-on therapy in trauma, especially crush injuries.
By fighting the ischemia and hypoxia.
Exactly. While there's some evidence for its role in multiple trauma, head injuries with swelling, maybe acute spinal cord injuries, its role in RA is still considered less established and needs more investigation.
Okay, let's try and wrap this up. In this deep dive, we've certainly seen that hyperbaric oxygenation, HBO, has this, well, surprisingly diverse range of potential uses.
Yeah, quite broad.
Especially for musculoskeletal and orthopedic problems, often stemming from trauma, and that resulting lack of oxygen.
Absolutely. We've looked at evidence suggesting it can be, a really crucial tool for saving limbs in bad crush injuries.
Right.
Offer real benefits in dangerous compartment syndromes, maybe improve outcomes in tricky nerve injuries, even speed up fracture healing.
And the osteonecrosis findings seemed quite promising, too.
Very promising, yeah. Definitely warrants more exploration there.
It's fascinating stuff, but I imagine some listeners might be thinking, wow, that sounds like it helps everything. Maybe a bit skeptical.
And that's a totally fair reaction. While there is solid research for some conditions, especially those acute ischemic ones.
Like crush injuries.
Like crush injuries, yeah. The source itself is careful to point out that we still need more research, more large, well-designed studies for some areas.
Like the nerve injuries in RA you mentioned.
Exactly. It's an evolving field. We're still learning exactly how the body responds to breathing high concentrations of oxygen under pressure.
Okay. So here's a final thought for you, listener, to maybe mull over. Think about oxygen itself, just oxygen, as a therapeutic agent. How might playing with atmospheric pressure, playing with the concentration of this essential gas, how might that unlock even more of our body's own healing potential? Maybe in ways we haven't even fully explored yet, beyond what we discussed today.
Yeah.
It really makes you consider how fundamental optimizing tissue oxygenation could be, not just for recovery from injury, but maybe for chronic diseases, too.
A fundamental factor, definitely.
Lots to think about. Thanks for taking this deep dive with us.